Today, I'm going to be talking about the gluten-free diet, specifically related to celiac disease and how it affects metabolism and obesity, as well as its health outcomes. So starting off, what is gluten? Gluten is a naturally occurring protein found in some cereal grains, such as wheat, rye, barley, and sometimes oats. The protein itself has distinct building properties that are used during food processing. It is also used for water binding and product yielding in food, which makes it a popular additive. As you can see in the picture here, gluten is located in the endosperm of grain kernels, and some common foods that contain gluten are bread, baked goods, pastas, different flours, and processed foods. So what is the gluten-free diet and why is it used? By definition, a gluten-free diet is a diet plan that excludes food containing gluten. This diet is a very important tool for individuals with celiac disease and other gluten sensitivities. Although this diet mainly helps those individuals, this diet can also be used to improve overall health by managing weight and preventing diseases such as diabetes. On the slide here, I have 6 alternatives to the gluten grains. And then I also have a my plate diagram here. And for the grains, it has adjusted the recommendations to include whole grain choices that are also pictured here on the left, and then advising to choose fewer refined grains like white rice, potatoes, and corn. So now I'm going to be talking about some chronic diseases related to gluten consumption. So the two main chronic diseases that I'm going to talk about first are celiac disease and diabetes. So starting off, celiac disease is an autoimmune disease where gluten causes a response within the body and harms the small intestine by causing damage and preventing the absorption of nutrients. On the right here, this is what the lining of the small intestine looks like before and after a diagnosis of celiac disease. As you can see, the villi have been damaged and flattened, which restricts the absorption of nutrients. And then diabetes is although gluten itself does not cause diabetes, overconsumption of it triggers responses in the bodies that do. When gluten is consumed in large amounts, it leads the body to being high in carbohydrates, which leads to a rise in blood sugar. And with sustained levels of high blood sugar, this can in turn cause diabetes. And many celiac disease patients are also type 1 diabetics. Both can be involved with genetics. And then gluten sensitivity is not technically a chronic disease, but it does have a relation to gluten consumption. It's essentially different for everyone that has it, and it's pretty much just an intolerance to gluten that produces symptoms that are not quite as severe as celiac disease. Those with a gluten sensitivity or intolerance may consume gluten and then sort of feel sick, experience bloating and things like that, but it does not damage the intestines and cause like the severe reactions that celiac disease does. So going off this again, what celiac disease is, it is an intestinal disease caused by an individual's intolerance to gluten. It disrupts digestion and the absorption of nutrients and requires a doctor's diagnosis, and this is done through blood work. The main symptoms include stomach pain, bloating, gas, joint pain, diarrhea, and then pictured here again, the damaging of the small intestine. And the primary care suggestion for celiac disease is actually implementing the gluten-free diet. As of right now, that is the main and only way to manage celiac disease. So celiac disease's effect on metabolism. Celiac disease individuals carry genes that make them susceptible to the effects of the disease, but there must be gluten present in a person's diet for the symptoms to occur. This picture here is the main antigen protein causing celiac disease, and it's called gliadin, which is rich in glutamine and proline and cannot be digested by human digestive enzymes and brush border peptidase. Most gluten is hydrolyzed by pepsin into high molecular weight peptides in the stomach. The peptides that enter the small intestine from the stomach are not easily degraded due to their rich proline. They stay in the intestine for a long time and increase the probability of triggering immune response. That would be, as seen here, again, the destruction of the villi, producing symptoms like bloating and stomach discomfort, things like that. When an individual is healthy, the intestinal flora located within the body protect the intestinal barrier, promote metabolism, and the absorption of nutrients. However, seen in the picture above, with a damaged intestinal system from celiac disease and gluten consumption, nutrients are not absorbed as they should be, and they are simply passing through the intestine. As you can see in the top right corner, the nutrients are just passing through, and the gluten is entering the cell. And this is a flow chart that shows the relationship between gluten and the intestinal flora affected by it. It starts with gliadin, the protein, which, after all those steps, ends in the imbalance of intestinal microecology. It's compromised, it's damaged, as seen in the picture before, which then ultimately ends in intestinal inflammation, which would be the immune response due to the gluten being in the body. So implementing a gluten-free diet has a major influence on the integrity of the intestinal flora, and studies have shown that those with celiac disease have other digestive tract disorders. By implementing a gluten-free diet in patients who have celiac disease, it can minimize their risk of harming their intestinal walls, which are vital for proper digestion, as it is the main site for it. And without proper digestion, metabolism is also impaired. Adopting a gluten-free diet lessens a person's intake of gluten products. These products usually require more enzymes to extract the essential nutrients from it. Because of this, it can boost metabolism and speed up the digestive process, which leads to more energy readily available in a shorter amount of time. So, in relation to obesity, there are not many studies to confidently say that a gluten-free diet can prevent obesity in celiac disease patients, as well as those who do not have celiac. However, there have been some done that show the diet does not lead to a significant weight gain as well. A study from 2012 reviewed celiac disease patients from the Celiac Center at Beth Israel Medical Center and used their BMI information to study the relationship between celiac patients and their BMI after implementing a gluten-free diet regimen. The original recorded BMIs are shown, as well as the BMIs after being diagnosed with celiac disease. And the data shows that those already in the overweight and obese categories maintained and sometimes even increased their weight after diagnosis. But on the other side, those at normal and underweight had a decrease. And sometimes a symptom of celiac disease can be weight loss, so it's not entirely alarming. And patients who were already obese were using a gluten-free diet, but using substitutions. And gluten-free items like bread can often contain even more carbohydrates than the bread containing gluten. So essentially, to maintain a healthy weight as a celiac disease patient with a gluten-free diet, the key is to cut out gluten and not make substitutions. In conclusion of the study, it was recommended that weight management instruction also be a part of managing the disease. So some different recommendations. Celiac disease patients should only implement a gluten-free diet under the direction of a doctor. For individuals who are not diagnosed with celiac disease, who believe they have a gluten sensitivity, could implement a gluten-free diet. This would be an example of what a healthy gluten-free diet looks like. Essentially limiting the high sugar intake as well as the overprocessed foods, increasing your dietary fiber intake, fruits, vegetables, legumes, nuts, all of those, and increasing the micronutrients. Those are important. Increasing intake of omega-3 polyunsaturated fatty acids. And then the big thing is increasing the consumption of naturally gluten-free cereals. This helps manage the weight and the symptoms. So the overall health outcomes, overconsumption of gluten leads to high volumes of carbohydrates within the body, and these carbohydrates cause a rise in blood sugar and insulin production, which over time can lead to the development of diabetes within celiac disease patients and those without it. Implementing a gluten-free diet can help minimize these risks. Overall, the gluten-free diet is one of the only treatments for celiac disease patients, and it helps maintain proper metabolism in the body and can help keep a healthy weight with proper adherence and prevents/treats chronic diseases. The gluten-free diet is also a diet adopted by many to live a healthier lifestyle. A gluten-free diet provides many options for those diagnosed with celiac and those who want to limit gluten intake due to some sensitivity.